Can you guys see my screen?
Yeah, we can see.
Yep, this is where we are. So for you guys joining for the first time, this is Mr. John. You can see the description there. I'm a registered nurse, licensed under Dubai Health Authority and Department of Health Abu Dhabi. I'm a coach, an instructor, and whatsoever you can describe. So for those who are not yet in our groups, we have a study group for those who are taking licensing in the UAE. We also have a study group for those who are preparing for NCLEX. So if you are preparing for either of these exams and you are not in these groups, please indicate after this live session so that I can include you. And you'll have some procedures to follow before joining. Like for the UAE, you should have proof that your verification is ongoing before you can join. For NCLEX, you should have watched the video talking about understanding the NCLEX process before you decide whether to begin the process or not. We don't want people who join us as observers. We don't want observers. We want people who are serious. Okay, that said, today we are continuing with what we had the last session. We started discussing some strategies of test taking, whether you are a medical doctor, a nurse, a midwife, lab technician, pharmacist, whatsoever. These strategies can be applied for any exam that you're taking. So we did a lot of them last time, which I titled it Test Taking Strategies Part 1, which we saw how you could use the ABCs, the prioritization, the nursing process, the Maslow's hierarchy, and so on. We saw a lot of that last time, and today we're going to see some of the strategies that were not mentioned. Like I said, it's a continuation. So welcome on board. I'm going to mute everybody. As I begin talking, I will give you the time to speak when necessary. For now, I do the talking. Okay. We here. So last time we practiced 13 questions. We saw the various strategies, and at each level, we did practice some questions. And after that, I have posted some questions in the NCLEX group. I expected you guys to apply those strategies, which we did last time, to answer those questions. And I expect that as you practice your questions, your scores should be increasing if actually you did understand the class of the last session. If not, please go back and watch the video. It's on our YouTube channel. Watch it over and over. It's actually long, but very, very important. So today we are entering, we are talking about some strategies that I like the most, and they are very common. If you apply them, you find yourself answering some questions very easily. These strategies we are going to see today, they are just 3 or 4. We are going to see they are very, very important. We are going to answer some questions and you see how we apply them. And please make sure that you apply them as you practice your questions. I want this session to be as short as possible. I don't want it to go more than an hour. I hope it will not go more than an hour because we don't have much to do today. So strategies are identifying options that are opposite. What do we mean? Last time we saw the question itself, the stem, the body of the question, on how you should be able to identify subject of the question, to be able to identify strategic words, what that indicate priority, what that indicate assessment. We saw that. So here we are looking at the options. When a question is asked and you focus on the options, you should look at the options that are opposite. What do we mean by opposite? Opposite in meaning or opposite in words. The examiner knows why those words are mentioned in the options. They should call your attention. we are saying these are strategies that will narrow you to easily identify the right options. Mind you, these strategies might not apply in all the questions, but most often, the high percentage, when you apply these strategies, you are able to answer even questions that you have no idea on them, like what we are going to see now. This question says, when assessing a client for an abdominal aortic aneurysm, which area of the abdomen is most commonly palpated? Okay, the subject of the question here is abdominal aortic aneurysm. This is the medical condition. And the event quarrel question is palpation. If you want to palpate, which area? This question is talking about us dividing our abdomen to the upper, lower, mid, the quadrant of the abdomen when you are doing physical examination. So you should have the anatomy of the aorta, where it passes. And when someone has this medical condition, abdominal aortic aneurysm, where should you palpate? Remember, we're doing palpation using our hands, our fingers. So this question wants you to locate. And in the options, by using the strategy of looking at the options that are opposite, will narrow you to picking out the answer. Option number 1 says right upper quadrant. The right upper quadrant. Is that where we are able to identify the aortic artery? Okay, if not, directly over the umbilicus. Is that where we are able, looking at our anatomy? Okay. 3 says middle lower abdomen to the left of the midline. What do you mean by midline? The body is divided. We have the lateral and the medial. Lateral means away from the midline. The midline is like dividing the body from up down, okay? And the umbilicus identified is on the midline, you know, the thorax here, the sternum going down. So if we want to divide the body to this side, lateral means going away. Midline, media means coming to the middle of the skin. So you should know this word. So when they say the middle lower abdomen to the left of the midline, so you are down to your abdomen and they're saying left to the midline. And then option number 4 is saying the same thing, but says the right of the midline. These are options that are opposite. It is likely that one of these options is correct. Please, this is a very important strategy. You will see options that they say bradycardia and tachycardia. There is no medical condition that will have sign and symptom of bradycardia and tachycardia at the same time, right? So when you see this word, these are options that are opposite. One of them is correct. You see an option that says something is increasing, and then the other option says it is decreasing. This should call your attention. These options are opposite to each other. They might not use the word increase and decrease. They might use increase and then they use decline, decreasing, or reducing whatsoever. But they are opposite in meaning. So focus on these two options, and one is correct in most cases. This is what the strategy is talking about. Options that are opposite to each other. One of them is likely to be correct. So by not having the content of this question, you already eliminate option 1 and 2, and your focus now is on 3 and 4. Now you do the gymnastics you want to do and choose one. You might pick the right one. But if you know the content and you know the anatomy of this question, you will know that the right option here is 3. In other words, we can palpate for this medical condition above, just above or on the left side of the umbilicus. Not 2. 2 says directly over the umbilicus. It's wrong. Why am I bringing this? You might find a question tomorrow or somewhere that says we can palpate for abdominal aortic aneurysm just above the umbilicus and on the left side, just above and on to the left. This is correct. It is the same as the middle lower abdomen to the left of the midline. The umbilicus is the point on the midline. And the left side, to the left side of the umbilicus, you will palpate the abdominal aorta. They say left to the midline, means it's just closer to, it's not lateral, not far away, okay? So it's just closer to the umbilicus, but on the left side, if you palpate here, you will get the aortic artery, where you'll be able to palpate for abdominal aortic aneurysm. So you have to read on this and to better understand what we are talking about. But this question, I brought this question for you to be able to apply the strategy of identifying options that are opposite to each other, making sure that noting that these options, one of it is likely to be correct. Yeah, one of it is likely to be correct. Moment, I'm looking for. Okay, so we said 3 is right here. Let's see another question still on options that are directly opposite. Let's look at this question. Most of you might have seen this question. A post-thyroidectomy patient transferred to the ward develops tetany. The nurse should suspect that the patient has a post-thyroidectomy patient transferred to the ward develops tetany. Tetany is like twitching, cramping, right? The nurse should suspect that the patient has a hypokalemia, means low potassium, hypocalcemia, low calcium. 1 is low potassium, 2 is low calcium, 3 hypermagnesemia, high magnesium, and 4 hypercalcemia. Which options are opposite to each other? Put them in the chat box. Someone said no volume. Can you guys get me? Sorry, I've been talking. Is it okay now?
Yes, I can get you.
Yes, I can hear you.
Okay. Mr. Valentine, can you get me now? Okay, volume is okay. Maybe you check your Zoom app. Okay, now, which options are opposite? Put in the chat box, please. Let's participate. Let me know if you understand it. Identify the options that are opposite to each other. Good. 2 and 4. Yes, 2 and 4. So this, by identifying these options, you already eliminate 1 and 3. Right? you eliminate 1 and 3, and you are left with 2 and 4. Between 2 and 4, 1 is correct. Whatsoever, one of it is correct. This strategy is very, very unique and very important. After this, apply them in some, as you practice your questions, you will see that you are likely to pick the right options. So in this case, the right option is 2. Hypocalcemia is the cause of the patient experiencing tetany. Yes, Benis, 2 is the right option. Can you see? Did you learn something new? Have you ever applied this strategy before? Maybe you've been applying, but you don't know what you're doing. This is very, very important. Very, very important. Try the strategy. As you practice, you see you're likely to pick out the right options. Let's move on to the next strategy. Eliminate options containing close-ended words. Yes. Oh my God. This is very, very important. You have to read the question in between the lines. Read the question. Look at these words. Last time I said, in nursing, in medicine, you don't say things, this is only, this is always, ever, never. You don't say like that. What is a medication that is okay for this client might not be okay for this client. So you don't say this medication is good for every client, or it's not good for all the clients, right? So when you see an option that has these words in it, these are likely not to be the right option. Eliminate them. Just saying this, I have 3 people waiting. Oh my God. Let me add you guys. Sorry about that. Today's class is very interesting. I'm enjoying it. I don't know if you guys are enjoying it. Yeah. Yeah, okay. I've added you guys. Today's class is very good. These strategies are very good. Good enough, we did not do them last time because we were damn exhausted. We went for 2 hours and we just ended at this point. And today we are doing these important strategies as fresh as we are. Let's practice. Look at this word. Keep them in your mind. Let's apply them to this question. Yeah. A client is to undergo a barium swallow test and the nurse provides pre-procedure instructions, giving teaching. The nurse should instruct the client to take which action in the pre-procedure period. Remember, I don't want you to understand the content of this question. I want you to identify the words that we can eliminate, close-ended words. You see, these strategies, you can apply them even if you don't know the question, meaning you should not leave any question unanswered. You should be 50% chance of passing any question by applying these strategies. And now you are going to pass this question without knowing the content by identifying these close-ended words in the options and eliminating them, and then you are left with one which should be the right answer. Okay. 1, avoid eating or drinking after midnight before the test. Okay. 2, limit itself to only 2 cigarettes on the morning of the test. 3, have a clear liquid breakfast only on the morning of the test. 4, take all routine medications with a glass of water on the morning. Oh my God, this question is so nice. This strategy is good. Please tell me, Eliminate the options that you think. Let's eliminate the ones that are not correct. We'll be left with the right answer. That's what I want you to apply in answering this question. Put there in the chat box, which options have the close-ended words that we saw before? You want to see the words again? These are the words. Only, all, always, every, must, none, never. Back to the question. Identify them. Put them in the chat box. Barry, check again. Look at those words. Who is that? Benis. Yes, you're right. Coach Ayong, look again. There's still one pending that has the close-ended words. Barry, check again. No, you added one that doesn't have the close-ended word. Vivian, correct. Check again. You want to see the words again? These are the words. These are the words. Back to our question. These are the options. Okay. Option number 2 has only. Has only. Where is my sign here? Option number 2 has only. You don't say only. This is eliminated. Option number 3 has only on the morning. It's not correct. Eliminate. Option number 4 has all. Take all routine. When I was reading the option, you saw you could get me emphasizing on those close-ended words because I wanted you to identify them. So we eliminate 2, 3, and 4. The right option is 1. Without knowing this question, but by identifying close-ended words and eliminating them, you are able to grab a mark just with ease, no stress. Can you see that? Wow, this is beautiful. This is beautiful. You want to practice more of this? Yeah, this is interesting. Yes, it is. It is. Let's see. So the answer here is avoid eating or drinking after midnight before the test when you want to do a barium swallow test. Okay, that's the right option. Number 1. Let's practice again by eliminating close-ended words. Let's see, let's go. The nurse employed in a preschool agency is planning a staff education program to prevent the spread of an intestinal parasitical disease. Which prevention measure should the nurse include in the educational session? Yes, you're giving teaching on the spread of parasitical disease, and which this question again is a positive event quorum. Okay, you should identify the options that are positive, right? That are positive, that the nurse should include in the teaching. But we are going to answer this question by, first of all, eliminating the options that have close-ended words. That's what I want you to apply in this question. Yes. Eliminate options that have close-ended words. Option number 1, all food will be cooked before eating. Really? All food? Must we cook all food? Because we want to prevent intestinal parasitical disease? Really? 2, only bottled water will be used for drink. Is it possible? Is it realistic? Is it realistic? All toileting areas will be cleaned daily with soap and water. It's good, but all? Let's look at it. 4, standard precautions will be used when assisting children with toileting. What are standard precautions? Hand washing, you know, hand hygiene, hand washing, hand cleansing, sanitizing the hands with alcohol, with hand sanitizers, all of that. Standard precautions, basic standard precautions are very important in preventing. You have to teach what is practicable, what is realistic, what can be done, not imaginary actions by just saying things that cannot be achieved or attained. You don't just say things because you want to prove a point. Forget about my talking. Let's get back to the question. We are talking about identifying and eliminating options that have close-ended words. What are the words? All. 1 is eliminated. 2, only bottled water. Only is a close-ended word. 2 is eliminated. It cannot be realistic. 3, all tolerated. All is close-ended word. Eliminated. So the right option is number 4. Can you see this? Is this real? Yes, you guys were able to eliminate the options that have close-ended word. Like seriously? Yes, 1, 2, 3, out. Kick it out. You go out. These are the wrong options, incorrect answers. And we are left with 4 is the right answer. Oh my God. Mr. John, bring more of this question. Let's practice. Ah, God, this is so nice. This is so nice, right? We're going. We're going to practice another question on this. You want to practice? We've practiced 2 questions on that. Let's see another strategy. Yes. Who is that? Can you mute yourself for us? I'm sure you're on duty. Leo. Okay, I'll have to mute you. Consider options that contain open-ended words. We saw eliminate options that contain close-ended words. And we're saying that consider options that contain open-ended words. May. Yes, this is how we speak. Nursing. This may happen. Generally, these are the words. When you see words like this, it's possible that these options may be the right ones. We are just trying to, narrow ourselves to be able to pick out the right option. It might be true, it might not be true, but these strategies have been applied and proven to be true in most cases. Okay. Unfortunately, I don't have a sample question for this strategy. You should be able, when you're practicing, you come across this, focus. When you see this word, read the question, word to word, understand, read the option. Okay, take your time. These words are strategic words that mean a lot to you. They mean a lot in answering these questions, in choosing the right options. When you see them, they should ring a bell in your brain. This might be the right options. But when you see options that have close-ended words, kick them out. Yeah, let's get another strategy. Look at the umbrella option. Did we see umbrella option last time? No, at the introduction of the last session, I made mention of the umbrella option, but we did not practice. Now we're going to see how to apply the umbrella option. What did I say about the umbrella option? Last time I gave some examples of, I can remember, I said the patient is admitted with diarrhea, which standard precaution, infection control precaution, can you apply to this patient? And I said, I can remember, one was contact precaution, 2, airborne, 3, droplet, 4, standard precaution and contact precaution. Can you see something? I'm talking about umbrella option. Umbrella option is the option that includes other positive options in it together. So you see that point 4 is most likely to be considered more than option 4 to be considered more than option 1. Option 1 is right. It's contact precaution. But as we apply any other precaution, standard precaution, plus any other precaution that you have to apply, you must do the hand hygiene. You must always do that. So you see that in this example, option 4 is correct because we have to apply standard precaution and contact precaution. That's what I mean by umbrella option. Let's see it in this question. The home care nurse is caring for a client who has just been discharged from the hospital after implantation of a permanent pacemaker. The nurse should assess the client's home for the presence of which priority item. Yes, this is a pacemaker that is applied on the client, and we want to be able to identify the items that are not good for this client. Okay, so by applying the umbrella option in this question, we should be able to pick out the right one. Now, option 1 says hair dryer. Hair dryer, is it a priority? Does hair dryer cause any risks to the patient with pacemaker? Okay, we don't know. Let's move on. Electric blanket. Does it? Just by applying common sense, does it mean that in the hospital, if the patient has a pacemaker on, we cannot use an electric blanket to the patient? Okay, let's move on. Option 3 says electric toothbrush with holder. Really? Does it cause some risks? Option 4 says electrical items with strong magnetic fields. You see that? Okay. I will not give the answer yet. Give me your answer in the chat box. Let me see if you understand what we mean by umbrella option. Very, okay. That's your option according to you. Yeah. Yeah. Oh, everybody has, oh my God. Ah, this is now interesting. Can you mute yourself, please? Who is that? Okay, I think Iris was the one. Yeah, give me your answers. Yeah, everybody's having it correct. Oh my God, thank you guys for understanding. meaning I'm not wasting time here. This is damn good, you know. Yes, the umbrella option here is option number 4. Because option number 4, by electrical items with strong magnetic fields. Okay, this includes any item that has a strong magnetic field should be, the patient should be cautioned of this item. Now, study shows that a client with pacemaker, item 1, 2, 3 are safe for this client. They pose no risks, okay? Hair dryer, electrical blanket, electric toothbrush, television, radio, microwaves, they pose no risks to this client. But items that pose risks, they are like radiation therapy, okay? Metal detectors that are used at the airports. Please take note of this. What happened if you see this question and they did not ask the question, they did not include the umbrella option, but they mentioned this item specifically, like select all that apply, and they put hair dryer, electrical blanket, radiation therapy, metal detectors used at the airport, electric toothbrush, right? So these 2 items the client has to the portion of, okay? They pose a risk to the client with pacemaker, permanent pacemaker, okay? This is good. You can see the question in many ways, like the example that I quoted. You should be able to try to visualize, read, understand what the question is saying, okay? This brings us to the end of today's session. I wanted us to see these 3, 4 important strategies when our brains are fresh. When our brains are fresh, we should be able to apply these strategies when we answer questions. Okay, go back and watch the video we did last time. Use A, B, C subject of the question, Maslow's hierarchy, nursing process. Who is that, please? I will give you time to talk. Try to apply the strategies. We practice some questions. And today, affirmation is the same. Always have this in all my sessions. I want you guys to have this in mind, that you are a conqueror. Okay, you can do it, whether you are preparing for CBT UK, whether you are preparing for DOH Abu Dhabi or DHA Dubai, MOH, NCLEX, whichever exam, Australia, New Zealand, please, you are a conqueror. You will conquer, okay? Whenever you engage into any process, you are engaging to conquer. So you say, I am a conqueror. I engage to conquer. God help me. And God will help us. We shall make it. We shall make it. We shall make it. Thank you, guys. Unmute yourself and talk to us. Today, let's discuss. Today is less than an hour. Talk to me. Talk to us. Which topic do you want me to prepare for the next session? Unmute yourself. Indicate by hand. Go to the chat box and raise your hand. Please, any strategy for DOHPN exam? I learned that many people fail the exam. Angel, these strategies are applied to any exam that you're taking. Let me talk about DOHPN. Yes, it's true. From the report I have received from my candidates who take the exam, most of them fail compared to even DOHRN. And we have come to realize that DOHPN, we don't have enough preparatory materials out there. Remember, for DHA, it is the same exam, whether for RN or for AN. The same materials. The difference is the percentage, the score, the passing score. RN is 55 and AN is 50. For DOH, either RN or PN, 60% is the passing score, but the exams are different. And DOH exam is set by Pearson view. DOPN must pass. No, not 85, not 85. It's not 85 was before. It's still 60. Priscilla, is this the latest update? Where did you get it? We took the exam when it was 80%. It has never been 85 in the UAE. All the exams in the UAE before, you have to score 80% to pass. DHA, MOH, DOH, we wrote the exam when we had to score 80% to pass. But now the scores have been dropped. DOH, Abu Dhabi, you need to have 60% to pass. MOH, 60%. DHA, RN, 55%. AN, 50% to pass. Okay, I was saying that what we discover about PN is because, one, we don't have the materials for you guys to prepare. Two, we discover that they are setting it the standard of NCLEX. They are setting it the standard of NCLEX PN, not NCLEX RN. Okay, so henceforth, we will encourage those who are preparing for PN to use NCLEX materials. But the standard that they are setting for PN is different. I plan to make a video on this. I plan to make a video on this, especially on delegation. You have to know the responsibilities of a PN, of an RN, and the way they set the question, they want you to answer the question as a PN. It's not the same way that the RN will answer the question. I plan to make a video on it. I think this is why most people are failing PN. Notwithstanding, we still have some candidates who pass PN. We are not saying that everybody is failing. Some of our candidates have passed PN. Yes. Yes. Please, I would also like you to help us with the latest update on new generation of NCLEX. Yes. Yes. This is coming up next year. If you plan to take NCLEX, please take it before April 2023. Okay, I will prepare, I will do more research, and I will make a video on it. For now, I can't say much about this. What I know is that they will start a new generation in April 2023. So, and guys, what I got for those who have taken the exam, at the end of the exam, there is a survey. This survey has questions that are geared towards the new generation style questions. So they ask them to take this question. They want to continuously make a survey. And most of them are saying that, oh my God, it's crazy. Don't even think of it. It's crazy. I'm not, actually, nobody wants to begin the new generation. First of all, you don't have enough questions out there on that. All the big exam centers, the UWell, the Kaplan, the REMA, they are preparing questions on that. So first of all, you will not be able to have enough questions on that because it's the new system that they are going to begin. So that is, first of all, already a drawback. Okay, there will not be enough questions out there to practice on. So what can we do? It will still catch some people. People will still start because not everybody will take exam in class before April 2023. People will do it. And from there going on, we are going to know how it's going to look like, right? Yes, but if you want, you can start the evaluation now and you will take your NCLEX before April 2023. If you start your CGRS now, notwithstanding. Yes, Leo, I think I gave some tips on that. I will do more research and bring us a lot of updates. We can have them. Big exam, big NCLEX review like REMA, Nurse, Kaplan. You will go to their website. You will have updates on that. You go to their website, you will get update on that. Thank you. Which question again?
Hello.
Hello.
Hello, sir. Good evening, sir.
Yes, Dr.
Thank you.
Miara, you never miss
Yeah.
it, but you came today a little bit late.
Yeah. Thank you. I came in late today. Sorry, I didn't start from the outset. Thank you. Yeah. Please, I want to find out, sir. The actually I took DOH PN, which I passed, and I'm asking if somebody can take PN NCLEX, can take NCLEX PN. Yeah, you know, can arrange and take it. Is it possible? Thank you, sir.
Okay. Unfortunately, in the US, PN are not recruited out of the US.
Okay.
The opportunity for recruiting international nurses is given only to the registered nurses category.
Okay.
PN are those who studied in the US. They don't recruit PN out of the US.
Okay.
Secondly, if you have taken PN in the UAE, I think, if you don't mind, what's your highest qualification? I mean, the one you used to take the PN.
Yeah, actually, I have RN in my country, only RN in my country.
Good. That's why I wanted this. Okay, let me answer you. Fine. That's what I wanted to know. I do not want to conclude. I wanted to hear from you before answering you. Yes, you have RN. You are eligible to be RN in the US, UK, New Zealand, Australia, everywhere in the world. If you have done 3 years diploma in nursing or bachelor degree, only UAE that is demoting nurses is so crazy. It's crazy. I have said this over and over. All the assistant nurses and the PN nurse in the UAE with 3 years diploma, you are RNs in US, in UK, in Australia, you are RN.
Okay.
Yes.
Okay.
So we are doing NCLEX, you are doing NCLEX as RN, not PN.
Okay.
If you have done 3 years nursing course and are licensed in your home country as an RN, you are RN UK, US. Unless if you have done 2 years nursing, you cannot be RN.
I did 3 years. I did 3 years.
Yes, yes.
Did 3 years. He's okay, sir. Thank you, sir.
Any question? Let's round up. I'm checking the chat box. You can still raise.
I want to ask a question.
Yes, go ahead, my dear.
Yeah, please, I missed the umbrella options because I'm actually at work, so I could not concentrate fully. I didn't get the explanation of the umbrella questions.
Can you watch it when we post the video on YouTube? We are done with the presentation.
Okay, thank you.
Sorry about that. Another question? If not, we round up for today. Yes, somebody's hand is up. Please, I would really wish you to talk more on ECG. Okay, ECG, then I'll have to prepare a video on that. Yeah. This ECG is crazy for most people, especially if you have not practiced with ECG. It's always a difficult area, just like ABGs. But I think I have broken down ABGs for anybody who has been following me from the start. I don't think you should have a problem with ABG and drug calculation right now. Go and check my videos and watch them over and over. ABG section and ECG, these are areas that are causing headache for students in nursing students. And even when you leave school, you still have issues with this area, but I've actually tried my best to break down ABGs, and now most of you are able to answer questions on ABG. I will do same with ECG, see how to prepare some questions and prepare on this. Okay, I'll take note of that, Quinty Brown. Any other question? Without which we round up for today. Thank you guys for joining. Today we ending with 14 members. This is huge. This is much. This is good. And guys, please go to YouTube and subscribe on our channels. Okay, please subscribe, share our work with your friends and colleagues, and let's carry the subscription to 500. Share our videos, comment there. Let's say if the videos are good for you, then they should be good for others. That is all you can do to support us. We are giving you this knowledge for free. All you need to do is to share the work, comment, like, subscribe, so that when we have a video to post on Amgen Healthcare Consulting. So you should subscribe there so that when we post, you will be able to see to get the notification. Click also the bell notification, because when you subscribe without clicking, you will not get notification when we post a video. Thank you guys for today, and do have a wonderful evening and happy weekend to everybody. I'm signing out from my end. Thank you guys.